My name is Shria Ajay. For those of you watching the recording, today is July 16th, 2022, and I will be discussing connecting mental health disorders and drug abuse. First, a little bit about me. I'm a rising senior at Basis Scottsdale in Scottsdale, Arizona. A few of my extracurriculars are I am the president of Science National Honor Society, co-president of the Leadership Club. I'm a weekly volunteer at Phoenix Children's Hospital, where I run the coffee cart. And Phoenix Children's Hospital is also where I conduct my mental health research, in which I analyze the availability of mental health services in the Phoenix metropolitan area to compile a provider list of mental health services for patient families. I've also led an initiative to distribute science booklets and experiment supplies to patients at PCH, and all of these experiences have made me very passionate about pediatric medicine and global health. So let's get started. Connections to global health. Both drug abuse and mental health issues, both are global issues because they are widespread and impact people around the world. The statistics are 35 million people suffer from substance abuse disorder and 792 million people suffer from mental health disorders across the world. That's almost 10%. There's also the issue of inequity, in which only 1 out of 7 people receive treatment for their substance abuse disorder, and 1 out of 4 people receive treatment for a mental health disorder, especially in low and middle income countries. Inequity is a key word when discussing global health studies, and the lens of public health must be viewed when assessing how to ensure more people receive help for these disorders. Here's the outline for today. I will first be going over mental health, then more specifically into substance abuse, and then making some connections. Start with mental health issues. A mental illness is a health condition involving changes in emotion, thinking, and/or behavior that result in problems functioning in the real world. Some categories of mental health issues include anxiety, mood, psychotic personality, and eating disorders. There is a lack of mental health services across the world. First, I wanted to analyze the United States, which is where I live. The National Association of School Psychologists writes that the ideal ratio of psychologists to students in a school should be 1 to 500 to 700. But in reality, the number is more like 1 for every 1,408 students. This discrepancy is devastating because many of the students that should be able to go to school to receive mental health services are unable to do so. Additionally, 149 million Americans live in a federally designated mental health professional shortage area. There are shortages in every aspect of health, and mental health is certainly no exception. Second is low-income countries. Graciela Rojas in the Frontiers of Public Health Journal wrote that the uneven distribution of mental health resources contributes to the burden of mental disorders in vulnerable groups, especially in low-income and middle-income countries. There is currently a World Health Organization initiative to provide quality and affordable mental health care to 12 countries, some of which include Bangladesh, Ghana, Jordan, Nepal, Paraguay, the Philippines, Ukraine, and Zimbabwe. More initiatives like these are needed to ensure that people in these low-income and middle-income countries have access to mental health services. Third is stigma. A 2016 study on stigma concluded that there is no country, society, or culture where people with mental illnesses have the same societal value as people without mental illnesses. This is one of the key reasons that in many social circles, going to therapy or receiving other mental health help are looked down upon. Each of these are reasons why a person with a mental illness might not get help, whether that be because they do not have availability in their area or because of stigma from their family and friends around them. Next, we will move on more specifically to substance abuse. Many people don't think of substance abuse disorder as a mental disorder, but it in fact is. Mayo Clinic said in 2022 that substance abuse is a disease that leads to an inability to control the use of a legal or illegal drug or medication. Some vocabulary for us today are drug tolerance, which is decreasing sensitivity to a drug due to repeated use, which means that you need to take more of that drug to receive the same impact on your body. And withdrawal, which are the mental and physical symptoms experienced due to discontinuation of a drug. If a person experiences high drug tolerance and severe withdrawal symptoms, those are symptoms of substance abuse disorder, as well as continuing to take a drug even when it is causing financial or familial burden. There are many different ways to treat substance abuse disorders, and different rehab programs take on different perspectives to solve this, including different types of therapy and different forms of contingency management. But today I will be going over treatment medication. These medications are used to reduce withdrawal symptoms by mimicking the effects of certain substances. These medications include benzodiazepines, antidepressants, and methadone. These medications are extremely important. Even if a person has extremely strong willpower to stop using drugs and essentially turn their life around, this is very difficult without any medical help. Quitting what is called cold turkey by completely stopping to use a drug all at once can cause severe medical complications and even death. This is one key way that rehab is extremely important to those suffering with substance abuse disorder. It is not enough to just try to fix it all on your own. Oftentimes, these services are necessary for people to actually be able to improve and heal from this disorder. Without access to these treatments, there could be severe complications and threats to the person's health. Currently, 34% of low and middle income nations have not developed a substance abuse policy. These policies outline guidelines such as procedures for what to do when a person has substance abuse disorder and prescriptions for things like those treatment medications. Without these policies, many people in these countries will not have adequate support if they have substance abuse disorder. Additionally, going back to the statistic I shared earlier, only 1 in 7 people get help for their substance abuse disorder. By encouraging more people that do drugs to receive help and go to rehabilitation, more people will be able to have better, healthier lives. Next, some connections. There are many risk factors to developing substance abuse disorder, including genetics, but another risk factor is having an underlying mental health disorder. This is where the connections come in because those with untreated mental illnesses are more likely to develop substance abuse disorder. If your mental illness is untreated, whether that be because of the stigma surrounding you or because you don't have access to mental health resources, all that does is make you more vulnerable to even more medical downfalls. Additionally, using drugs can increase your chances of developing a mental health disorder other than substance abuse disorder. Cannabis could increase the risk of anxiety, depression, or even psychosis and schizophrenia, and cocaine and hallucinogenic drugs exacerbate previous mental health problems. In this way, it is clear that these two issues are heavily connected. Both of them have stigma against them, which need to be overcome to ensure people attempt to get the help they need. Additionally, the services are not always available to people that ask for them. Therefore, to conclude, improving accessibility to both drug rehabilitation and mental health services is vital to improving global health, whether that be through encouraging people to get help when they need it, decreasing the stigma surrounding both of these topics, and increasing accessibility around the world. Here are some of my references. I would like to say thank you to Phoenix Children's Hospital and Teresa Boger for developing my interest in the world of medicine and my research in mental health. Thank you to the Global Health Leaders Conference team for a summer of engaging and informative presentations, and thank you to my family. Here's my contact information. Feel free to email me if you have any questions.